I'm Dr. Prakash Vemgal. I'm a neonatologist and a pediatrician working at Rainbow Children's Hospital, Banagatta Road. Today I'm going to briefly mention or probably give you information about urinary infection in children. Urine infection is quite common even in a baby who is born to any child age group. Urine infection is mainly due to a bacteria which enters the urinary system. When we see children in our OPD, out of 10 patients, at least 1 to 2 can have urinary infection, and younger the child having a urine infection, it is more kind of risky because it can cause major issues. As a frequent infection happens to urine, it can damage the kidneys. So it's important for the parents to be aware about urine infection. First of all, how to diagnose a urine infection, what are the treatment options available, and what are the other investigations we need to do is most critical during the diagnosis of urinary tract infection. So if a child has high grade fever, it is not feeding well, it is feeling very miserable, it's vomiting, then you need to take your child to the pediatrician. So we examine the child, and based on the signs and symptoms which by history and by examination we come to know, we would do a simple test called urinary routine examination. Based on the urine routine examination, if we find there's a lot of pus cells, bacteria and nitrates are present, then we probably think that okay, there is a urine infection and that is the cause for the child's unwellness. So we start these babies on simple oral antibiotics, and we also request the parent to do another test called urine culture. And urine culture is mainly done to find out what bacteria the child is having in the urine, and this result will generally takes at least 2 to 3 days, and based on that report we can probably see what the antibiotics we are given, which is responded or not. Further, once the treatment is over, generally we give it for 5 to 7 days, and if the child gets better, we probably might have to do some other further investigation based on the child age. So I would request all the parents, if your child has any major fever, not doing well, kindly bring the attention to the local pediatrician, whomever you are seeing, and based on the further investigations we can advise you how to go about it. So don't neglect fever and urinary tract infection.